everyone. Thank you for joining today's PHCA webinar entitled OSHA's Record Keeping Standard Changes. My name is Abby Foster. I'm Director of Marketing and Member Services for the Pennsylvania Healthcare Association. PHCA offers monthly webinars to members for NAB-approved credits in order to receive updates from department staff on regulations, learn from industry experts on current trends, and gain a better understanding of practical application tools to equip you so you can continue to provide the highest level of quality care possible. Before we begin, I have a few housekeeping items to cover. The webinar will be recorded and made available on PHCA's website by the end of today. The webinar has been approved for 1 continuing education credit for nursing home, assisted living, and personal care administrators. Certificates will be emailed immediately following the webinar with a link to the survey. Please complete the survey, and if you're participating in a group setting, please have each participant also complete the survey. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit questions via the questions pane on the right-hand side of your screen, and our presenter will address them at the end of the presentation. On to the content. In May 2016, the U.S. Department of Labor's Occupational Safety and Health Administration issued a final rule to modernize injury data collection to better inform workers, employers, the public, and OSHA about workplace hazards. With the new rule, OSHA is applying the insights of behavioral economics to improve workplace safety and prevent injuries and illnesses. The new rule took effect on January 1st, which took effect January 1st, 2017, requires certain employers to electronically submit injury and illness data that they are already required to record on their on-site OSHA injury and illness forms. The objectives of today's webinar will provide attendees with a review of the new OSHA record-keeping reporting and submission requirements. Content that will be reviewed includes which injury illnesses need to be reported to OSHA, the ongoing obligation employers have to make and maintain accurate records of work-related injuries and illnesses, what is considered to be compliant employee involvement in the incident reporting program, and acceptable and unacceptable post-accident drug testing policies, and we'll also cover at the end a brief review of the penalty adjustments that went into effect August 1st, 2016 and were updated January 15th, 2017 at the end of the webinar. This webinar will be presented by Dale Glacken, Compliance Assistant Specialist for OSHA's Harrisburg office. We appreciate his time and thank him for being here. Dale, the floor is yours.
Good afternoon, and thank you, PHCA, for inviting me out today to go over some of these record-keeping changes. The electronic portion is more current, but there's been some other changes that a lot of folks are not aware of that have actually evolved over the last 2 years, and that's where I want to start our presentation today, to start with some of the items that are already on the books, but people do not know about them. We're not going to hit everything, but I'm going to try to hit all the high points that relate to you to try to help you be successful with your safety program. As Abby had mentioned, these are the type of items that we're going to look at. What needs to be reported: employee involvement, involving your incident program, incentive programs, post-accident drug testing, the electronic submission requirements for your injury and illness data, and then your ongoing obligation to make record-keeping changes. And where I want to start out is an area of concern that I have. First, I would like to say between companies, their employees, and OSHA all working together over the last several decades, we have been successful at lowering our injury and illness rates and our fatalities throughout the nation. We've had good success there. You can see by this chart we're moving in the right direction. However, what I will say, when we look at more recent years' data starting in 2013, we're seeing we're starting to slide on our fatality numbers. Those are harder for a company not to show us sometimes, so it's actually a much better piece of data for us. And then when we look at the rates, that's the number of fatalities per 100,000. 2013 we hit the low, and then 2014 and 15 you can see the numbers of rates at the bottom going from 3.3 to 3.4 creeping up. So we need to keep vigilant in our efforts to reduce injuries and illnesses, which ultimately do result in the fatalities. So where are we seeing our problems? Well, the predominant area is transportation, followed by falls, then violence in the workplace. Yes, violence in the workplace. It's hard to imagine. That's number 3 on our list, followed by the 4th one there, contact with objects. Now, I'm not going to go into a lot of charts and details with you on these today. I just wanted to let you see where we're at with our numbers, how we've made good success, but we need to get back to it and keep looking for these opportunities to make our workplaces safer. And speaking of which, this is the area where OSHA is actually finding the majority of their violations. A lot of fall protection. This could be slippery work surfaces, maybe in a kitchen or in a facility. It could be somebody working on a roof replacing a filter on a ventilation system, or another walking and working surface. So fall protection goes beyond, say, construction. Hazard communication has been one of the largest violations that we have had since 1984 when that standard came out. Lockout, tagout, electrical. So we're seeing a lot of different areas where we're finding problems, and I just thought I should let you know what we're seeing out there. Well, let's jump into the record keeping portion, and the first piece I want to talk to you about is how we've changed the rule on what needs recorded and reported to OSHA. As you can see, this rule came out in January 1st, 2015, and this deals with your OSHA logs, that's your record keeping, and then your reporting piece, which would be notifying OSHA that you had an incident. And what I would like to point out as well, I work with a lot of folks, and sometimes they feel the workers' comp is the same as what OSHA requires. Now, the rules are different, and if at some point you need me to actually take time and review the specific OSHA recording piece and go through how to fill out your OSHA log, I'd be happy to do that. But the OSHA piece is not the same as workers' comp. And what I will say is workers' comp is not the same throughout the different states as well. So that makes it more complicated if you have facilities outside Pennsylvania. So who does the recording piece? And just to review, a company would be exempt from the recording if they had less than or equal to 10 employees at all times during the year, and they also were on our partial exemption list. Now, in looking at your NAICS codes for your industry, the 62310, 62331, and 62331, they are not exempt. They are required to keep these records. And then, of course, if any other federal agency has a requirement to keep records, you need to keep them for them as well. So let's look at what the reporting requirement is. And what that is, if you have a fatality, you need to notify OSHA within 8 hours. As an employer, you cannot count on the coroner or the state police or somebody else. This is the employer's responsibility. Likewise, if you have an inpatient hospitalization, an amputation, or somebody loses an eye, there's a 24-hour requirement on that as well. And I want to actually dig into this a little bit further with you. So what is a hospitalization? A hospitalization is the formal admission of that employee to the inpatient hospital of a hospital or clinic for care or treatment. It doesn't count overnight stay or length of time somebody spent in the facility. Maybe they go into the ER and they're there for observation. That doesn't count. It's the formal admission to the inpatient service of a hospital or clinic. And the hospital actually makes that determination. So then what is an amputation? An amputation is the traumatic loss of a limb or other external body part, such as a limb, an appendage that has been severed, cut off, even fingertip amputations without any bone loss. That would be considered an amputation. Loss of an eye, that is the physical removal of the eye from the eye socket. So just as an example, somebody's working with sulfuric acid, they get it in their eye, the eye is damaged, it can no longer be used. That wouldn't count. It has to be the physical removal of the eye from the eye socket. Now, if somebody has a fatality, it has to be reported to OSHA within 8 hours. But after 30 days, if somebody were to pass away, that would not have to be reported to us after the 30 days. Likewise, with an inpatient hospitalization, amputation or loss of an eye, if it occurs within 24 hours, you let OSHA know that. After 24 hours, you would not have to let OSHA know. So for example, say somebody was not hospitalized for 24 hours after the incident, then you would not notify OSHA. Or if there was an amputation beyond the 24 hours, you would not have to let OSHA know that. However, if you weren't aware, the employee did not notify you, or management was not aware, then when does that clock start ticking? And what it says here, if you do not learn right away that the reportable fatality, inpatient hospitalization, amputation, or loss of an eye was the result of a work-related incident, you must make the report to OSHA within the following time period after any of your agents learn about the fatality, the inpatient hospitalization, loss of an eye. So it's 8 hours for the fatalities. You have to let us know. And then as far as the inpatient hospitalization, amputation, or loss of an eye, when you learn about it, that's when that clock starts ticking. And if you're not sure, just call OSHA to make the call. And I'll show you why in a few moments here. Okay, if it occurs on a public street, you don't have to report it unless it's in a work zone, but you may still have to record it if it's a recordable injury. The rules between reporting and recording aren't the same. Don't get them mixed up. Work with the rules that you know for recording. This reporting thing, though, as I said, 8 hours for fatality, 24 hours for the inpatient hospitalization, amputation, or loss of an eye. So what about observation and diagnostic testing? Well, that's not really care or treatment, so you do not have to tell OSHA if you have somebody in for only observation or diagnostic testing. So just in summary of a few of these things, you do not have to report it if, one, it's not work-related, it's in a motor vehicle accident, not in a construction zone, but in a public highway, if it's public transportation, or if it occurred more than 30 days after the fatality or more than 24 hours after the incident. So how do you do this? You have three options. First, you can notify your local OSHA office. Two, you can use our 800 number. Or three, you can go electronically onto OSHA's webpage. And for those who don't know who their local OSHA office would be or where they're located or a contact, here we have the state of Pennsylvania. There's 6 area offices, and the name that you see listed is the area director for each of the office, as well as the phone number. You're always welcome to use the 800 number as well. So what information would you report to OSHA? Pretty much everything you already have on your accident report form. Who, what, when, where, why, and how. All the normal things that you would keep track of on your accident report form, plus one item that you may not already have. And if you don't have this item, I'd recommend you put it on your form, and it's number 12 here. What are you going to do to prevent a reoccurrence? Because that's the real idea for reporting and recording injuries and illnesses, is that you go back, you look at where you have had your issues, and you make correction, prevent somebody else from getting hurt. An area where we get questions is, what about this temporary worker? Who's responsible for them? And basically, if you have people on your payroll who are not on your payroll, but you supervise them on a day-to-day basis, we consider them to be yours. So you would need to record that temporary worker injury. Likewise, if it's a fatality, inpatient hospitalization, amputation, or loss of an eye, if you're supervising them, then you need to let OSHA know that as well. And the way it's looked at is there's a shared responsibility between the host employer and the temporary agency. And if you're supervising them, then you're in control of their work on a day-to-day basis. Now, what I've run into is that there's a lot of companies that the temp worker would actually report the issue to their temp agency, and the host employer doesn't hear about it. That's why you need to establish procedures. Sit down with your temp agency, make sure you've worked out a procedure that everybody's on the same sheet of music, so that whenever an incident is reported, that everybody is made aware of it. Okay, so now that you've called it into OSHA, what happens now? Well, what OSHA does, they have a triage to determine if an OSHA inspection will actually occur. And this is the triage tree that's used. They go through some questions to determine what they have. OSHA then has two options. Either perform the inspection or allow you to do it, and that's called an RRI, a Rapid Response Investigation. It gives you the ability to conduct your own internal investigation. You could determine why it occurred, what the hazards were, and what corrective measures need to be taken to prevent it from occurring again. So what happens OSHA will send you or call you and go over the incident, tell you that they're going to allow you to do the RRI, the Rapid Response Investigation. They'll ask you for your email address. They'll send you an incident report form and ask you to conduct an investigation of your own. You have to do that investigation within 5 working days, and if an item needs to be repaired, replaced, fixed, or whatever to prevent it from occurring again, you need to let OSHA know within 5 days what you've done or what you've started to abate that particular hazard. A copy of your letter that you receive needs to be shared with your employee representative, Safety and Health Committee, needs to be posted for employees to see, and a signed copy needs to be sent back to OSHA to acknowledge that you've received it, but you have 5 days to do that investigation. So say it takes longer than 5 days to abate a hazard. Maybe it takes longer to get a part in or to repair an item. Well, then you can request additional time, but you have to do that. You just can't assume that they know you need additional time. You got to get back to them. Keep OSHA in the loop. Now, if you don't report an incident to OSHA, there is a penalty for that, and this is the unadjusted penalty. It doesn't take into account your size or your history or any other factors, but it starts out, as you can see, $9,054, and it is adjusted from that point. So you do need to notify OSHA if you have one of these. You don't need to receive a citation for this because you didn't make that call. And yes, we are still finding employers who aren't aware of this, and I don't want you to be one of those. So after the first year of doing this, for 2015, we've actually had about 10,000 of these reported, a quarter of which were amputations, 3/4 were hospitalizations. And we allowed the employer to do 62% of the investigations to get back to OSHA. Now, I'm due any day for the update on what they found in 2016. I have not received that yet. And then here's a little bit further breakdown. But you can see on the RRIs, that's the employer investigations, there was a total of 62% that the employer did, and OSHA did 38%. The bulk of which OSHA went out on were the amputations. We have a whole piece on our webpage to help you. If you get stuck, you can always call us. We'll send you in the right direction and help you with this process. And we've even put out a fact sheet to help. From here, I want to kick into the next piece on this improving tracking of workplace injuries and illnesses. And the cause for this was that OSHA is trying to modernize the injury data collection process to help everybody understand what type of injuries are occurring out there and where do we need to take additional steps to try to prevent these. Plus, employers are already required to keep track of these. So here we're just making it an electronic system. So here's kind of a summary to this section, and there were several implementation dates, but the big thing I want to show you is this form at the bottom. And we see in here about employee rights, electronic reporting, and then we get down here to the bottom. And we have a number of years where this system phases in. So let's start out with the employers with 250 employees or more. In 2017, the only form they need to give OSHA is the 300A form. Likewise, with companies in certain industries, and yours is included in this, I did check that as well, with 20 to 249 employees, all they need to report to OSHA electronically, once again, is the 300A form. So that's your summary report. That's what you hang up between the 1st of February and the end of March of each year. And the date for that, when you'll need to have it in the system, is the 1st of July. So that's the first year. Then when we move to 2018, the larger companies are going to have to put their first report of injury, that's your 301 form, your OSHA log, your 300, and then your summary report, the 300A, into the system. The smaller companies with 20 to 249 only ever have to put in that summary report form by the 1st of July of that year. Then moving forward, 2019 and beyond, it continues as the prior year, except now rather than having a submission deadline of the 1st of July, now it goes to the 2nd of March. So that's a big piece. We're going to talk more about these things, but we have a lot of stuff to talk about in this section. So to help, there's been a lot of information put on OSHA's webpage to help folks with frequently asked questions, fact sheets, and the website itself. So let's start tearing into this. There's three main elements of this rule. One is getting the employees involved, prohibiting against discrimination, and finally, your electronic submission of data. So let's talk about the first one, employee involvement. You need to set together a reasonable reporting procedure for employees to report injuries and illnesses. You need to let employees know about the procedure, and you also need to let them know that they will not be discriminated against for reporting injuries and illnesses. The procedure needs to be reasonable. It would be reasonable if it doesn't deter or discourage an employee from reporting an injury and illness. We want them to do that. And then there's been a question that's come up from folks, and there's been some concerns with this thing called time and means, and I want to review that with you. Time would be if you want an employee to report an injury and illness to you as soon as practicable. Sometimes people don't know they've had an injury and illness or they've had an issue. It would be nice if everybody could promptly report things to you, but sometimes they just don't know. For instance, maybe a worker didn't know that they had an injury because the symptoms did not manifest to a later point, such as a musculoskeletal injury. They may not have realized it. Or maybe something built up over time, had a latency period, didn't appear originally. Maybe somebody had a shoulder or neck pain that wasn't bad, but over time it got worse. So there needs to be a balance between when employees report injuries to you, and that's the time piece to this. We'd also see where people may not report it initially if they had asbestosis or silicosis. I mentioned musculoskeletal earlier. Maybe if somebody has a swelled ankle, that today it was fine, they come in the next day and here it is, it's swollen. So sometimes you don't know immediately. That's the time piece. The means is it would be reasonable for somebody to call in or email you, or come in if it's practical, depending on what their situation may be. But to have them go to a remote location to report an injury and illness, or have some barrier that would prevent somebody from reporting, that's what OSHA wants to get away from there too, the means part. So how do you let employees know about their rights? Talking about employee rights. Well, employers need to let employees know about their rights to report injuries and illnesses. And a good way to do that would be also with your OSHA poster. You should have these posted in your facilities for folks to see. And what are some of the rights? Well, a worker has the right to raise a safety and health concern or report an injury and illness without being retaliated against. So we jump over to the OSHA poster, and just in summary, it requires people to be trained in a language they understand, work on machines that are safe, being provided with safety gear to work safely, be protected from toxic materials, the ability to request an OSHA inspection, or speak an OSHA inspector, report an injury and illness, get copies of medical records, see copies of their injury and illness logs, review records, get copies of test results. And those are just some of the items listed on the poster, and there's more in the OSHA Act itself. I kept mentioning the word discrimination. Discrimination can mean a lot of things. It can go everything from being fired, laid off, or less subtle actions such as isolating, mocking, falsely accusing an employee of poor performance, and everything in between. Those are possible examples of retaliation. That's what we're trying to avoid. We want people to report injury and illnesses so items can be taken care of. The new rule goes a little bit further, and it also talks about discouraging reporting, incentive programs, and drug testing. A couple very helpful documents have been put out over time to help employers. This particular document, and I'll include it in a link, and you will be able to pull this up yourself and go through it. But this particular one breaks out incentive programs into 4 different types of what OSHA is concerned about seeing. We also have this document, and we're going to spend some time on this document. This is the latest piece that has come out, but it lays out a number of different scenarios of what OSHA does and doesn't want to see in the form of questions and examples. The guidance that came out in the original Federal Register was written, but it didn't have a whole lot of concrete examples. This has a lot of good examples that will actually step you through the thought process, and that's what we're going to spend some time looking at. But we're going to talk about a couple other things first. And as you can see, it gets into disciplinary, incentive, and drug testing programs. And our concern is if people don't report injuries and illnesses, the problem's going to be concealed, it's not going to be investigated, nothing's learned, nothing can be corrected, people may not get the proper medical attention, and workers may not be made whole. And earlier we looked at our statistics. For every one of those fatalities, there's a certain number of lost time injuries, a certain number of restricted days, a certain number of close calls. We can't get ahead of those if we don't take action when we do see a problem. That's why it's so important for an employee to report an issue so that it can be corrected on the front end. And I will point out, because I've seen a lot of different articles in different magazines about this, the rule does not ban disciplinary actions, incentive programs, or drug testing programs. They're very good tools. I know prior to working for OSHA, I was a safety manager for a number of years. I had about 10,000 employees I was responsible for before I had moved over to OSHA. I found incentive programs to be a very effective tool. I found our drug testing programs to be a very effective tool. So we're not banning those, but we're defining how they can be used appropriately. So let's start with the first one, disciplinary programs. As I mentioned, it does not prohibit disciplinary programs. However, employers must not use disciplinary action or the threat of disciplinary action to retaliate against an employee for reporting an injury or illness. A couple things to watch out for is disciplining employees without regard to the circumstances of an incident, failing to enforce the rule against other employees who also violate the rule, whether or not they had an incident, using vague work rules that really don't give any substance to what the employee's expectations are. A couple other areas that we run into. Say you have an employee, they're working along, and let's just pick a piece of equipment. Let's say it's a crane, let's say it's a forklift or whatever, and the operator hurts another employee, and the employee who was hit by the machine is drug tested, but the one operating it is not drug tested. You know, there's some disparity there. And that's what we're asking people to look at. So what I want to do is start running through these scenarios. I have about 12, 13, 14 scenarios to run through with you. The first one, we have an employee who's stung by a bee at work, reports it to the employer. However, the employer disciplines the employee for violating a work rule requiring employees to maintain situational awareness, and the employer only enforces this particular rule when an employee gets hurt. So the question is this a violation of what we're looking at here for OSHA? And it's actually in point 35 of the standard. So did the employer violate that part of the standard for reporting a bee sting? And the answer would be yes, because the employer only enforces the work rule after a work-related injury and illness is reported. Plus, it's a very vague rule. So that's the first scenario. And these are all laid out in that other document. We have a second one. An employee reports a hand injury that she sustained while operating a saw after bypassing the guard on the saw, contrary to the employer's work rule. The employee's hand requires the person to miss 2 days' work. The employer disciplines the employee. The employer regularly monitors its workforce for safety. So the employer is on board. So it just wasn't this isolated case where the employee gets in trouble. Did the employer violate the rule? And the answer to that would be no, because it was a legitimate rule. And we actually want to see employers have good work rules for the workers. They train them, and they take consistent, appropriate action as necessary. The third scenario, if somebody twists their ankle but didn't immediately realize it, ankle wasn't swollen, everything was fine. The next morning, however, the ankle is sore, it's swollen, and he realizes there's an injury here. The employer, he reports the injury to the employer, and the employer disciplines the employee for failing to report the injury immediately. So this goes back to what we talked about earlier about the time and means. So did the employer violate the OSHA by disciplining the worker for failing to report the injury immediately, even though the employee did not realize they were injured? The answer to that is yes, because the employee did not realize it immediately, and it would not be reasonable to discipline that particular employee. It needs to be reasonable, practical, after realizing that there was a work-related injury. Now this is quite similar to the previous one. The difference being halfway down through, the employee does not report this after realizing it and instead reported it several weeks later. Now the employer disciplines the employee for failing to report it. So the question is, did the employer violate this? And this time the employer did not, because the employee should have reported it in a more timely manner. Let's jump over to incentive programs, which was the second category. And we don't want to use incentive programs that penalize workers for reporting work-related injuries and illnesses, or deny a benefit as part of an incentive program. So let's just take a look at some more of what we're looking for here. That one memo that I had pulled up gets into these 4 different types of incentive programs, but basically what we'd like to see are incentive programs that will reward people for doing the right thing. They're positive means of encouraging workers for doing the right thing, rewarding them for being involved. And a couple good examples, and these are things that I actually see whenever I'm out, and I go to some companies where we work with them, and they actually have outstanding safety programs. There are what's called our VPP companies, Voluntary Protection Program. And here's a couple of some things that I've seen whenever I've been out. Providing T-shirts to workers for serving on a safety committee. It's an incentive. They're proud of their T-shirts. Giving a reward for strengthening ways to make a better safety program. I've had companies recognize workers for pointing out safety hazards so that somebody else wasn't hurt. So they reward them for that. Giving a recognition party at the successful completion of a company-wide safety and health training. Reporting hazards. Participation in the investigation of hazards, near misses. Giving training. Maybe helping management out, giving some training to the other workers. Responding to close calls, being part of a preventive maintenance program, complying with the rules. Hey, you did a good job today. That's what we want to see, things that reward people for positive action. So let's look at some incentives. Here we have an employer that has a substantial cash prize drawing each week, for each work group at the end of each month, in which no employee in the work group sustains a lost time injury. So we have an employee, and he reports an injury that he sustained operating mechanical power press. The employee didn't violate any rules, lost 2 days. So then the employer cancels the cash prize for that month because one employee had an injury. So the question is, does this violate what OSHA wants to see by canceling the cash prize because one person had an injury? And the answer is yes, because an employee was injured and reported the injury without regard to the circumstances. It was across the board. Nobody got the prize. It's on the negative side. It's not proactive. It's actually a negative program. Here we have a second example, another cash prize drawing. we have an employee falls from a platform not wearing the required safety protection. The employer cancels the drawing for that month because the employee failed to wear the required protection, and the employer actively monitors its workplace for compliance with applicable rules and cancels cash prize drawings when it discovers the work rule violation, regardless of whether or not somebody had an injury. So the question is, did the company do right? And the answer is yes, the company does right, because regardless of whether there's an injury or not, they cancel the prize because somebody didn't do what they needed to do, regardless of having an injury. Here's another scenario. Same as the last one, except at the very end here we see the employee routinely failed to wear the required fall protection, but the only time the employer cancels the cash prize drawing is when an employee reports an injury. So you have an employee, he reported this injury, and that's the only time the cash prize is canceled. Does the employer get in trouble for that? Yes, because it has to be across the board. It can't just be when somebody has an injury. Scenario number 4. This one's different. An employer holds a party for all employees who complete safety training. Here we have an employee who failed to attend the training because they were absent due to a work-related injury that they reported. So that employee is excluded from the training completion party because she did not complete the training. Employer consistently excludes employees who fail to complete the training course, regardless of why they failed to complete the course. So did the employer did okay in this one? Yes, the employer did okay. They did not violate the rule because they continued to have the party, but they excluded the employee who didn't do what was needed. So that takes us to the last piece of this part, and this is the drug testing. Once again, we do not prohibit drug testing of employees, and there's certain laws that might already require it. The Department of Transportation has rules. Maybe it's a federal contract, or there's a state law that requires it. We're not getting in the way of that. If they require it, then it needs to be done. It only prohibits employers from using drug testing or the threat of drug testing to retaliate against an employee for reporting an injury or an illness. So a little bit that was in the Federal Register that accompanied the rule, and when you read through it leads a lot to be interpreted, and so we're going to look at these examples for this section as well. But I just want to read partway down the page where it says drug testing policies should limit post-incident testing to situations in which employee drug use is likely to have contributed to the incident and for which the drug test can accurately identify impairment caused by drug use. For example, it would not be reasonable to drug test an employee who reports a bee sting, repetitive strain injury, or an injury caused by the lack of a machine guard or a tool malfunction. Such a policy is likely only to deter reporting without contributing to the employer's understanding of why the injury occurred or in any other way contributed to workplace safety. Employers need not specifically suspect drug use before testing, but there should be a reasonable possibility that drug use by the reporting employee was a contributing factor. And these couple of lines have been subjected to a lot of interpretation, and what I find is that handout that I'm going to send you the link to, and we're going to look at these examples, actually helps step you through the process. I think the examples are really, really well thought out, and they do help a lot. And I just want to revisit, if it's required by a state law, DOT, post-accident drug testing, then it's okay. I know where I was a safety manager, we did pre-employment, reasonable suspicion, random, and at that time we did post-accident drug testing, but looking back under this new guidance, it's probably not appropriate. So I'm learning here too. I will say though, when we had our drug testing where I used to work, we would try to get the employee well We would try to turn that problem into a solution, and as a result, we would send them out to drug cessation programs, follow up. We did more random drug testing. The reason being, we wanted the person to clean themselves up and be a valuable employee. It's not always easy to get good employees, and sometimes they get themselves in trouble, and that's what we tried to do. We tried to make them whole, try to bring it around. So here's some scenarios again, and here we have an employee had to take a drug test after reporting a work-related carpal tunnel syndrome. There's no reasonable basis to suspect that drug use could have contributed to the condition. There's no other reasonable basis for requiring this person to take a drug test. But the employer here, it says, routinely subjects all employees who report work-related injuries to a drug test regardless of the circumstances. So is this what OSHA wants to see? No, we don't want to see that because it's across the board. There's no legitimate reason. If it's a carpal tunnel. We have another one. Here we have an employee inadvertently drove a forklift into a piece of stationary equipment. Would it be suitable then for the employee, the employer to do a post-accident drug test? And there's no problem here because the person's operating a forklift and it could have contributed to his injury because drug use can affect conduit. Number 3, an employer drug tests all employees who report a work-related injury to the employer to get a 5% reduction. The employer drug tests all employees who report work-related injuries to the employer to get a 5% reduction in worker comp premium under the state's voluntary drug-free workplace program. And I'm not aware of one of these within Pennsylvania. Employer drug tests an employee when she reports a work-related injury that could not have reasonably been caused by drug use. So did the employer get in trouble for this one? And the answer is no, because in this particular state, and you might have people in another state that does require it, it's okay when a state program requires it. Now here's a slight twist to the previous one. The employer requires all employees who report lost time injuries to take drug tests because the employer's private insurance carrier provides discounted rates to employers that implement such drug testing policies. So if you have an employee have an issue and the employer drug tests the employee when they report this injury, is there a problem with that? And the answer is no, because we're trying to maintain consistency between the public and private workers' comp programs. Number 5, this is the last for the drug testing. Employer requires employees who report lost time injuries to take a drug test regardless of whether drug use could have contributed to the injury because the drug testing requirement is included in a collective bargaining agreement at the workplace. So that's the key part to this whole thing. Employer drug tests the employee when she reports a lost time injury that could not have been reasonably caused by drug use, such as a bee sting or carpal tunnel. The employer had no reasonable basis for suspecting that drug use could have contributed to the injury. So did the employer violate the rule? So the question is, how do we look at this collective bargaining unit? And basically, collective bargaining units cannot supersede OSHA. So in this particular case, the collective bargaining agreement doesn't count. Now, if it would have been a state program or a state insurance or a DOT requirement, that would be a different story. But this is a collective bargaining, and that does not supersede OSHA. So this is that page that I had showed you earlier. This is what I want you to take a look at. Maybe it's a little bit of homework for you, but this is the document, and it gets into these different scenarios. And I really like it because it really gives good examples, I think, that the Federal Register really didn't. The Federal Register, it was a little hard to figure out. I think this helps. Now, within the Department of Labor, there's a group called the Whistleblower Program. And within Whistleblower, they institute 22 different statutes which go beyond OSHA. It can be DOT, Consumer Product Safety Commission, Environmental, Clean Air Act. There's a lot of other rules. And they've put out some guidance through OSHA to help you with an anti-retaliation program. And I'll send the link for this as well. But it basically puts together what you can put at your workplace for your anti-retaliation program. And I've summarized just in these 5 little bullets what the whole document gets into. I recommend you go through the whole thing if you're putting together one of these programs. But basically, management needs to lead the program. They need to have that commitment, accountability, and if you want to sum it up, lead by example. Second, they need to have a system to listen to and resolving employees' concerns. So some way for people to report things. Where I used to work, we had a commander's hotline. They'd call it in there. Companies have those. Maybe it's a complaint box or whatever, but it's a way or multiple ways. Next, a system for receiving and responding to these. So, okay, maybe it comes in anonymously. How do you get that information back out to the workforce? I've met with some companies where the plant president literally makes it a point once a month to meet with different clusters of employees, listen to their concerns, and then whenever giving a response back, not just responding to that little cluster, but actually putting it out on the bulletin boards where everybody can see it across the board as to what they found and what's going to be done to take care of a particular situation. Then none of this means anything without training the workers. They need to know the expectation, so that's the training piece. And then finally, program oversight to make sure that nothing's missed. But that's all pretty well laid out in that document. Well, let's go to our next section now. This is the electronic reporting, and we talked about this earlier in that summary sheet. But basically, if you have 250 or more, 250 employees or more, you're going to have to, starting in July 1st, 2018, submit your 300A, your 300 log, and your first report of injury, your 301, to OSHA electronically. Now for this year, you only need to do the 300A, the summary. I've had people come back saying, well, we're not comfortable about giving out employee names and addresses. Do not include that. We don't need that. We don't need the physician's name. We just need to know what occurred in that system. Smaller companies, I looked at your specific NAICS code, and you are not exempt. You need to submit this information as well, and that's your 300A starting on the 1st of July of this year. A couple other reporting requirements. We're a federal OSHA state, so this doesn't pertain to Pennsylvania, but say you have somebody in Maryland or Virginia, they're state plan states, and they too are going to have these rules in place. So it's just not federal OSHA, it's state plan as well. We're not adding any responsibilities to companies to keep track of this. We're just asking you to transmit the information to us electronically. So how do you submit it? OSHA's putting together a secure website, and to keep everybody up to date on what's going on, we've actually released this piece of the web page, and keep an eye on it because the system as of last week was not up and running. I cannot speak for this week, but it's a new system, and it's coming. It's not 1st of July yet either. So what are you going to be able to do in the program? Put in your establishment. Maybe you have multiple establishments. You're going to be able to edit your establishments, be able to put your data in. And how are you going to put the data in? Well, you could either manually put it in, or if your system is set up in the proper format, you could use what's called this comma-separated value fields and actually stream the information right into our system. But what you're doing has to be compatible with what we have. After you've put it in, the system's going to tell you, yes, it was a success, or no, it was not a success. It'll give you a phone number and a website to go to if you get stuck. And there's going to be a testing area, which I'm hoping to try out myself to help people understand how to put the information into the system. So stay tuned. I have not used this yet. As of last week, it was not operational. I have had questions from folks, though. Can they let a third party submit their data for them? And most certainly. but the employer is still responsible for the information that goes in. And I've had many questions on some of the basics on record keeping. What is an establishment? And this establishment is a single physical location where business is conducted, or services or industrial operations are performed. For activities where employers do not work at a single location, construction, transportation, communication, sanitary services, whatever the case may be, the establishment is represented by the main or branch office, terminal stations that either supervise the activities or the base for which personnel carry out these activities. So these are some of the establishment questions I've been receiving, so I thought I should share those today. Are the electronic reporting requirements based on the size of the firm or the establishment? And OSHA looks at each individual establishment, because a firm can be comprised of many establishments. So what OSHA looks at is each establishment, not the firm as a whole. As far as determining, mentioned here a little later on in that slide, your employment, you got to take your peak employment for the year, and each individual employee in the establishment at any time of the year counts as one employee, including full-time, part-time, seasonal, and temporary workers. Here's a question that we received regarding a company with multiple facilities on a larger campus, but each facility has less than 250 people. And so the question is, how should I count my employees to determine if I have to electronically provide OSHA my injury and illness records? And basically, under most circumstances, campus would be considered one physical location, and it would also be considered as one establishment. But under limited conditions, it could be multiple. And when can you do that? And it says here, you may divide one location into two or more establishments only when they're a distinctly separate business. That means they're doing things different. They're separate. Different economic activity. No one industry description, that would be your NAICS code, applies to the joint activities. And separate reports are routinely prepared for each establishment on the number of employees, their wages, salaries, and so forth. Can an establishment include more than one physical location? And then this is another one. Yes, but only under certain circumstances. An employer may combine two or more physical locations into a single establishment only when the employer operates the locations as a single business under common management. They're in close proximity to each other. There's one set of business records for wages and salaries. And then they give an example here. One manufacturing establishment may include the main plant, a warehouse a few blocks away, admin buildings across the street, but they're all close proximity. May a firm with multiple establishments make a single submission of the data from multiple establishments? And this is as far as making that electronic submission, and the answer is yes. A firm with more than one establishment may submit establishment-specific data for multiple establishments. To do this, the firm will create one registration and follow the directions provided to submit data for multiple establishments. So there's still multiple establishments, but they're all being listed in there. It is important to note that the electronic reporting requirements are for data at the establishment level, not the firm, but at the establishment level. The submitted data must be specific for each individual establishment. Here, this company has a firm that has multiple establishments that do different things. What determines whether or not they have to submit the data for those establishments? The industry classification for the firm or the classification for the establishment, and OSHA works by the establishment, so go with the industry classification of that establishment. Posting, and this is kind of a review, this is nothing new. but I get questions on this as well. How do I post the annual summary? And it says you must post a copy of the annual summary, that's your 300A, in each establishment in a conspicuous place or places where notices to employees are customarily posted. You must ensure that the posted annual summary is not altered, defaced, or covered by other material. When do you do it? Between the 1st of February and the end of April. So during that period of time, if OSHA were to knock on your door, they are going to look for this posting. So make sure you have it up. Now this is something that came out about a month ago, and a lot of folks haven't heard this requirement, so I thought I should throw this in today as well. Other than the obligation identified in the record-keeping standard, do I have further recording duties with respect to the OSHA 300 logs and 300 incident reports during the 5-year period? And it says you must have an incident report for each and every recordable injury and illness. However, you're not required to make additions or corrections to the incident reports in the 5-year period. And I kind of jumped ahead here, so let's go back to the previous slide. You must make any additions and corrections to the OSHA log, that's your 300, that are necessary to accurately reflect the changes that have occurred with respect to the previously recorded injuries and illnesses. Thus, if the classification, description, or outcome of a previous case changes, you must remove or line out the original entry and enter the new information. So you have 5 years you got to keep these alive. And a good example of this, I think of the worker who has a hernia. They have a hernia this year, and maybe they went to the doctor and they talked about it, and they're working out some of the details. And that was last year. Now this year they go for the surgery. So before they had not lost any time, but now they're losing time. Maybe they're away for a few weeks through the recovery process. That's one that would change. So if that happened to you, you'd have to go back and correct that 300 log to make sure it reflects what occurred within that 5-year period. So the log isn't finished when you put it into the file. Now these rules are all on this part of the OSHA webpage, and I'll send a link to you as well to help out. We've also developed fact sheets to help you through this all. Now I had offered to go over the increase in penalties with you. What had happened, OSHA's fines haven't been raised in years. The rule changed. There were and as a part of the rule change that took place last year, the penalties went up 78% as to what they had been before. So all penalties used to start at $7,000, and then they were adjusted for about 10 different factors. Size of a company, if there's a history with a company, is it a repeat, or whatever the case may be. A lot of different factors. And the top number, the highest serious violation would come out at is $7,000. The willfuls, the repeats started at $70,000. So as a result of the cost of living calculations, the numbers have gone up now 78% what they had been formerly. So we're now looking at over $12,400 for a serious citation, and for a willful or repeat. A willful is you know you have a hazard and you've done nothing to correct it. Repeat, you had one of these before and you're being cited for the same thing within a 5-year window. That's a repeat. Or maybe you have another facility down the street. You have one 2 states over. Whatever the case may be, if it's a repeat, if it's your company, it's a repeat. Those start at over $124,000. So you don't want one of those. You definitely have to do what you can to prevent that. What I used to do when I was a safety manager, that was one of the first talks I would send out to everybody each year. We had plants all over the country, and I would send out what we had been cited for within the prior years. And I've told people we don't want to see another one of these. So make sure you're vigilant. You make sure I had a couple blocked exits. to make sure that that did not occur again. I did not want to face those type of citations. And now in today's world, the numbers are even more. They've gone up 78%. Now what happens is that January 15th of each year, the numbers are reviewed and looked at for cost of living. So what happened in January of this year, they went up 1.01636%. So they've actually gone up a little bit more between last year and this year. The big jump was last year. That was the cost of living. And I'll send some links to you on that as well. I have a fact sheet on that. A couple things we're trying to do. We're trying to get ahead of our falls, and we're asking everybody to look at where people could slip, trip, or fall in their workplace. They have a toolbox talk or a safety meeting with their workers. They go through what can go wrong, what they can do to protect themselves. Maybe you need to put mats down. Maybe you need to squeegee the floors. Whatever the case may be. Maybe it's the winter time. You have some ice to deal with, or whatever the case may be. But you're taking action. We're asking people to do this fall stand down on May 8th through the 12th. And if we're doing it, you go onto this piece of our webpage, put in what you did, and we'll send you electronically. You can print these out. You might want to save it as a PDF file. These certificates of participation in the fall stand down. Or maybe you have some maintenance folks that go up onto your roof, or whatever the case may be. We're trying to get ahead of falls. What I have seen in falls over the last 8 years, they've been creeping up on us. We had roughly 180 falls more last year than 8 years ago. They're creeping up on us. We're trying to get ahead of those. Seeing too many falls. We have our web page to help you. It's OSHA.gov. We've got a lot of quick takes. We can send you an email every 2 weeks to tell you what's new in OSHA, to try to help you, show you what's new out there. We have a lot of publications. You can download these directly. You can use them in your safety talks. You can use them to help your employees. And some places I go to actually get the employees involved and let them help out with the safety talks, and that's an opportunity to reward the workers for doing the right thing. One of the companies that I work with have about 120 workers, and for everything that a worker does to help their safety program, they actually get a 50-50 ticket. They rip it in half. The worker keeps half. The employer puts half in the fishbowl, the other half in the fishbowl. And for everything they do, the more things they do, the more tickets they get in the fishbowl. At the end of the month, this particular employer pulls one ticket out of the fishbowl and gives that employee a gift certificate for $30 at a local restaurant, and the workers really like that. And it helps the employer because the employer knows, okay, I have 12 months in the year, $30 a month, so they know what their incentive program is going to cost them, but it encourages the workers to want to do the right thing. So maybe you can get them to help do some of your employee training. We have our literature, too, in other languages. This is some of the Spanish information that we have. To help smaller employers, and that's if you have less than 250 on a site, 500 in a company, you can qualify for free government help. In Pennsylvania, we use IUP, the Indiana University of Pennsylvania, their consultation service. We've used them for 33 years. This is not college students. This is not professors. This is trained safety people who actually come out and will look at your workplace and make recommendations. I've had companies try them to see what they think. They'll start with a little area of their operation. If they like what they see, they bring them back to do more. I haven't heard any bad results from using these folks, and as it says, it's funded by OSHA. It's good. Now, if they find something, we ask you to fix it. That's the cost of the program. If they find an issue, and hopefully you want to fix it anyway. This is the folks that they've actually helped throughout the country. And here's their contact information. Indiana University of Pennsylvania, OSHA consultation. And OSHA doesn't pay them directly. What happens is OSHA writes a check to each state, and then each state has a contract. So they're twice removed from OSHA. So they don't report directly to OSHA. And then you saw this slide earlier. This is who to reach in your local area. There's 6 area offices in Pennsylvania to help you. Each office has a duty officer. Some have 2, and these are folks that come in and out of the field. They're compliance folks, so they see stuff every day. They answer questions for the public. They do not have caller ID. They're there from 8 to 4:30. So do call if you have questions and let them work through your answers for you. And that's all I had. Are there any questions?
We don't have any questions as of yet. If anyone has any questions, you can just submit them on the right side of the pane. There's a questions portal, so you can just submit those, and we'll give it a couple minutes and wait for any of those to come in and field those. Thank you again to Dale for that very thorough presentation on some timely information, and we'll pause for a couple minutes as any questions come in. Thank you again, everyone, for your participation. I got a couple questions on the content. All the content will be emailed before the end of today, as well as your certificates. It takes a little while for us to convert the file and post it up to the website, but it will be sent before the end of today, which will also have the PDF and of the PowerPoint. Please remember to take some time to complete the survey that will be emailed along with it. That's for your credit issuance process. Thank you again to Dale Glacken from OSHA. We'll include with the email the follow-up today with all of the helpful links and resources that Dale mentioned. And this is the conclusion of today's webinar. Thank you for participating.